Hello, my name is Terry Cho, and I'm CEO of Modus Health. Today, we're doing an overview of StepWatch for clinical care. StepWatch is a fully validated activity monitor with many clinically relevant metrics for inpatient and outpatient care. StepWatch is worn just above the ankle while passively measuring walking and therapy in daily life. Our solution involves clinician software, a secure Modus Cloud, and patient software called our companion app. The patient software can go on a patient's own mobile device or a clinic-provided mobile device. Our solution is both FDA listed and CE marked. What makes StepWatch so unique is its reliability and accuracy. This is a study looking at accuracy in daily life. The consumer wearables all undercounted. The medical device studied Actigraph on average overcounted and had a lot of variability in accuracy depending on the participant, whereas StepWatch was nearly 100% accurate in the real world. More important is how these wearables do in patients seeking health care. This is a study of 166 inpatients that had impaired walking. The consumer devices dramatically undercounted, as did the medical device studied in this publication, whereas StepWatch was 98% accurate. Also, what's important to note in this study is that all the other wearables had some percentage of patients where they detected 0 steps during a 6-minute walk test, whereas StepWatch was accurate in all 166 inpatients. One of the reasons StepWatch is more accurate is that it tunes to your patient. When you set up StepWatch, it will ask for you to enter the height of your patient and answer 2 questions about mobility. Next, you'll have the opportunity to adjust their walking goals. After this, StepWatch will record when every step is taken. Now we're going to focus a bit on the clinician software. In the clinician software on the home screen, you have the mobility triage report. This displays how all of your patients are doing and which ones met and did not meet their mobility goals yesterday. It sorts the patients that did not meet their goals at the top, since they likely need more of your attention. We also have a messaging system that allows you to ask your patients questions or to answer your patients' questions remotely. At any point during the mobility process, you can, of course, update the patient's walking goals. Also, in the clinician app, you can view any patient's daily metrics. The green bars are the days the patient met all their goals. The red are the days the patients did not. That hatching you see are the steps that were taken during therapy versus the total day. Our gait report allows you to adjust what days you're interested in. So you can see the StepWatch metric averages over the period of time you wish to review. Also in the clinician app, you have the option to set StepWatch to separately monitor the therapy session. Here we have a real-time therapy view. So this is set to show the patient and the clinician the patient's walking in real time. Regardless of whether you do a connected view or another type of therapy session, you will have the saved therapy metrics in the app for you to view later. In our patient app, we much more simplify the system. The patient will be able to see their status towards their walking goal. At any point during the day, they can tap Update Now to refresh their walking both on their app, in the cloud, and in the clinician app. They can view their own gait report, and they can scroll down to see where they are towards reaching the stepping goal, the peak steps per minute goal, and the minutes active goal. For those more into tech, they might want to tap All Days to see their daily bar graph. And there are 2 ways in the app that they can, of course, send you a message if they have a question around where they should walk and how much they should walk, or if they have any concerns around walking. StepWatch costs $300. This is discounted relative to what we sell StepWatch for with our other software programs. And our clinical care software is an annual subscription. The amount of that software depends on the number of patients that use the system each year. I can say, though, that the per patient cost will go down the more patients that use the system at your clinic. If at any point you don't use the full subscription in 1 year, you can transfer 50% of that subscription fee to the following year. If you have any questions or want to learn more, please reach out to orders@modushelp.com. We're happy to set up a live demo, discuss pricing, and answer questions. Thank you for your attention.